New at 6, concerns from the local dental community and the American Dental Association.
It comes as a major insurance provider purchased dozens of dental offices here in Wisconsin.
Why did you reach out to TMJ for?
I reached out because for the first time in Wisconsin state history, we have a large dental insurance company that is acquiring dental offices throughout the state. When the same entity is responsible for providing dental benefits and dental care, the line gets really blurry.
Dr. Emily Eckdahl is a dentist in Brookfield who questions whether it's a conflict of interest for the owner of a dental office to also be able to decide what's covered by insurance.
Lighthouse reporter Ben Jordan takes those fears directly to Delta Dental of Wisconsin.
Wisconsin is one of just a handful of states that does not require dental offices to be owned by licensed dentists. But Dr. Emily Eckdahl never expected an insurance company would take advantage of this opportunity.
You're not going to drive down the street and see Delta Dental owns this dental office. You're going to have to do some investigative work on yourself to decide if that office that you're attending is where you want to go and who owns it.
State filings show Delta Dental, the nation's largest dental insurance provider, now owns dental offices in Brookfield, Mequon, and New Berlin, to name a few, after it purchased 25 practices across Wisconsin from Cherry Tree Dental.
Why might this be a concern for the patients?
There is a conflict of interest in if the patient's diagnosis and their treatment needs are going to be the main focus or the overall financial aspect of the company.
Eckdahl isn't the only one on edge.
One entity shouldn't control the entire transaction.
The Wisconsin Dental Association says it's heard from dentists all over the state about this acquisition.
I think they want to make sure at the end of the day the patients aren't being cheated or the patients are not being served in a way that the dentists want to be served.
A few weeks ago, the American Dental Association issued a strongly worded statement about Delta Dental becoming the payer and provider. Quote, "From a business standpoint, dental insurance companies seek to minimize cost and maximize profit. As a result, patients may find their treatment options limited to what is most cost-effective for the insurer, not necessarily what is most effective for their oral health."
Were you expecting that kind of feedback?
You know, we were. When we engaged in this transaction, we knew there would be questions.
Delta Dental spokesperson Jed Rower says the main reason it bought dental offices is to ensure there's access in rural parts of the state, but it acknowledges several of them are in the Milwaukee metro area.
Ultimately, what does it mean for patients of these practices?
Ultimately, today, nothing changes. With Cherry Tree Dental, they're going to have their own independent leadership team that's making all carrier contracting decisions. They're going to be having those kind of rate-setting negotiations independently.
Back at Eckdahl's office, she worries this could be just the beginning of a larger trend in Wisconsin.
This is maybe a slippery slope into the future. Wisconsin being the first state, with these being the first 20-something offices, we don't know if this is going to turn into 200 offices or 2,000 offices.
If you are a patient at one of the Delta Dental offices and you have questions about what this means for you, reach out to me at ben.jordan@tmj4.com. Reporting in downtown Milwaukee, Ben Jordan, TMJ4 News.